beats there. So don't come alone, bring your family and your clique. Jolly's ones who treat you like an MVP all week. You know where to find me, go like 10 to 20. Jolly's Pharmacy will never leave you lonely.
Good morning, good morning, good morning, and welcome to yet another episode of Jolly's Health Vibes. We're happy to be with you here this morning in the studios of Q95 FM to bring you, as we always do, a health talk show with some vibes and with some energy. My name is Trudy, and joining me this morning is Jacinta. Jacinta, good morning to you.
Good morning to you and good morning to our listening audience. How are you today?
I'm good. I'm good. It is rainy today and so not as hot as it's been over the past few weeks or
Yes,
days, and so
definitely.
I'm enjoying the little chill atmosphere at this time. I'm enjoying it, so I'm good.
That's very good.
Hmm.
But what I can say though is even though we are enjoying the rain
Uh-huh.
and it's a bit cooler, it's still a bit,
You feel it's
humid.
humid?
Yes.
Yeah. Yes. Yes.
But we are thankful for the showers of blessings.
Mm-hmm.
And of course, everybody who lives in areas prone to flooding, take note.
Mm-hmm.
But before we begin the show, Trudy, I really want to thank our many customers
Mm-hmm.
who enjoyed the good time, the
Mm-hmm.
gifts, the deals, and just sharing the moment with us last week
Mm-hmm.
for Customer Appreciation Week. It was a success,
Yes.
celebrating 45 years of existence, and each year we go bigger and better.
Right. So, Customer Appreciation Week last week, I know it was a big success.
Yes.
And I do want to shout out Team Jollies for executing yet another successful week of appreciating customers. I know all the different departments had a role to play. The
Yes.
marketing team
Yes.
was very hands on there. And then, of course, everybody that was in store itself, the pharmacists, etc., everybody had a role to play. Even when I went out to Megaland last week, Saturday,
Mhm.
I saw, different Jolly's employees interacting with the children and really even appreciating. I did not get to attend the Jolly's, the children's clinic,
Okay.
which happened before Megaland on Saturday.
Right.
But from what I saw at Megaland, all employees were very hands-on. So everybody got a feel of the Jolly's customer service
Yes.
and spirit during Customer Appreciation Week. So I feel it was a big success. So
It
kudos to the
was, it
team.
was. Thank you.
Kudos to the team. And for the customers who won gifts and prizes during
Mhm.
Customer Appreciation Week, I hope that you continue coming to Jolly's Pharmacy, because you never know when next you will be appreciated. But every year for sure in July, you all do it really big.
Yes.
Yes.
Thank you again.
Yes. Jacinta, I want to say good morning to our regular listeners. I see that some of them are popping on our social media platform of Q95 FM, Facebook page, and the YouTube channel. And I want to just shout them out. I see Natalie Simon is already on with us. So good morning to our constant listeners. And for those who are constant, regular listeners, loyal fans of Health Vibes, I encourage you this morning to share those lives, Facebook YouTube to get other people on, because this morning we have a guest in studio, and she's going to be giving us some very interesting information. I would say we're going to be having a very interesting discussion. So if you know that somebody may want to tune in to Health Vibes, you need to remind them by sharing the live. So that is my advice to all of you who I see popping on the social media platforms of Q95 FM. Jacinta, we're going to take a break. And when we come back, we're going to introduce the guests. If you were on looking at us live, you'd already see who we have in studio. If you saw our promotional flyer before the show, you'll know who we have in studio. But we will introduce her when we get back from the break. So we'll be right back.
I hear people say the excitement way too high. Jolly's pharmacy and trust me, even if it's me alone, to take a fishing boat on 99 days to reach down there. From the 10th of July to the 20th is right. Customer Appreciation Week. There will be cardio jams and helping Megaland, community outreach, big sales and giveaways and double points of prestige day. So don't come alone, bring your family and your clique. Jolly wants to treat you like an MVP all week. You know where to find me, July 10 to 20. Jolly's Pharmacy will never leave you lonely.
And we are back with you. This is Health Vibes. And as I promised before we took the break, we have a guest in studio with us this morning. And we are very excited to have her. She has been on Health Vibes before. As a matter of fact, Jacinta, when we did some trivia last week for Customer Appreciation Week, we had a show with trivia. And one of the questions was name 3 doctors who have graced us with their presence on Health Vibes. And one of the callers actually got this guest's name correct. So so she remembered when this guest was on the show earlier this year. So she's a return guest. The Dr. Alison Abel Seaman is in the house with us this morning. She is a vascular surgeon, and this is her second time on Health Vibes, and I hope it's not the last time because her field is so very interesting. Dr. Seaman, good morning to you.
Good morning, Trudy. Thank you for having me. Good morning. Good morning, Jacinta. Thank you for having me today on Health Vibes. It's a pleasure to be here. It's a pleasure to share knowledge. Knowledge is strength and wealth for our patients.
Okay? Doctor, if people don't know or don't remember, because as I said, you've been on the show before, tell them what it is that you do. Vascular surgeon, what does that mean? What is that profession? What does it entail? What do you do?
Okay. So vascular, when we talk about vascular, we talk about the blood vessels, the circulation. And what are the circulation? What are the blood vessels? The arteries, the veins of the body, and the lymphatic system. And as a surgeon, I can operate on the pathology of these processes.
Okay.
Yes.
That sounds very interesting because we always hear of the systems in the body that work together, our veins and arteries pumping blood, and if they do not work in cohesion, then some type of disease or condition can arise from it.
Definitely,
So
yes.
I really think that our listeners would be very intrigued to know what type of conditions come
That
about
arise, huh?
if those veins and arteries do not work properly, and what can be done.
For them.
Yes,
Mhm.
definitely.
And doctor, are you the only specialist in that field in Dominica?
In Dominica, so far, yes, I am.
Yes,
big
so
up
it
to
is
you.
so it's a novelty for us on
Yes.
island to have a vascular surgeon, and so that's why I was so happy that she decided to come back, because I don't know if it's because she is now practicing in that area that I'm just hearing so many issues about circulation.
problem.
Yes, popping up in the media. Recently, we had the president of America, Donald Trump, diagnosed with chronic venous insufficiency.
Yeah.
And it was very interesting because, if people follow the story of Trump, President Trump, it was said that he was fully healthy, no conditions and so on when he was running for a second term as president. And then this diagnosis came up, and I guess it made the news because it was like, okay, this is the first time that it was being said that he has a medical condition.
Right.
So, Dr. Abel, I want to know, what is it that diagnosis really is, since it has been floating around so much in the news?
Okay.
Mm.
So chronic venous insufficiency, it's quite a common pathology,
Mhm.
common condition, but it is very overlooked.
Okay.
Okay. Now, to understand what is venous insufficiency, we have to know what the veins do in the
Right.
body.
Mhm.
Okay. So the veins is the circulation that carries blood in reaching carbon dioxide. It takes it from the tip of your fingers, from the tip of your toes, and it carries it up to your heart.
Okay.
Okay, so that is the main purpose of the blood, to collect all the waste materials, the carbon dioxide, the substances that our body does not need. It has to collect everything and bring it up to your heart so it can be replenished. Okay. Now, inside of these veins, we have little valves. We have little valves. And over a period of years, these valves, they get weakened.
Okay.
They get weak. Right? So once we have a faulty valve, that blood is not able to flow in the direction that it is supposed to.
Okay.
Okay? And as a result now, the blood is not going to travel up your legs sufficiently. So it becomes insufficient. So that is what we call venous insufficiency. It's the inability of that vein to carry up the blood
So you focus on our legs.
in your legs. Yeah.
Right.
You'll mainly see that condition in your legs, although it can happen in the upper arms, in the upper extremities, but it is mainly focused in the legs.
In the
okay.
legs.
So as a result of the blood not being able to go up as it should, it pulls back down, and it kind of stays stagnant and collects. And from there, you start to see the different pathology, the different signs and symptoms that the patients complain about.
Okay.
So that is the whole concept of venous insufficiency, the inability of the veins to do their job.
Right. And interestingly, my next thought was, what would lead somebody to know that they have an issue? So what are the signs and symptoms of venous
that the patient
insufficiency?
Okay, so before we get to that, to the answer,
Mm-hmm.
I will have to say that this pathology is quite common in persons who do a lot of standing.
Okay.
So we have the hairdressers,
Mhm.
we have the barbers,
Mhm.
we have healthcare professionals, we
Mhm.
have the security guards,
Right.
policemen,
Teachers.
farmers, teachers.
Mhm.
These are the main group of persons who suffer venous insufficiency because they are always on their feet for
Okay.
long periods of time,
Yeah.
for long number of years.
Mhm.
Okay, so they suffer with that venous insufficiency.
Okay.
Okay,
Okay. So that's the high risk
high risk
population, people who
very
stand.
much so,
Okay.
very
but,
much so.
But Doc, before I continue, not to trip you, sorry.
Mhm.
As you mentioned, this group that's more susceptible in acquiring this type of condition. I remember my mom. She was both a teacher and principal, and she's lighter than I am, and so you could see very clearly veins popping up, especially to the back of her legs. Is there a difference between this condition and varicose veins, or the cause? Because she stood for very long periods of time.
Yes, there is a comparison. There is a difference. Okay, with the varicose veins, the veins are sick. They are not functioning properly. The valves inside of these veins, they are weakened. They are not closing as it should
So similar to
push up the blood.
Okay.
However, you are persons who do a lot of exercises, so you
Right.
tend to see that their veins show up more. That is
Okay.
not varicose veins. It's
Okay.
because they have less muscle fat, less fat. You will tend to see the veins, but it is not varicose veins. It is not
Okay.
varicose veins.
Okay. But can it be said then that somebody who does have varicose veins, because you mentioned that the valves are not working in those veins, somebody with varicose veins would likely have venous insufficiency?
Yes.
Okay.
Yes.
Okay.
Yes.
It can lead to it,
Yes.
or it can be a
Like it's
probable
associated
cause,
with?
right?
Okay.
Okay.
All right.
Okay.
So we are back to the signs and symptoms.
Yes.
So
Signs and
we
symptoms.
outlined the high risk
Yes.
groups, those people who stand for long periods of time, over many years, you would say. And how would they start to present if they have venous insufficiency?
And also to add to the group, we have a family history. So if your mom, auntie, you may as well.
Okay, so if you have a family
Yes,
history of that condition,
of venous
you have to look at
insufficiency.
yourself.
Exactly.
Okay.
You'll also find it in persons in the older age group, in the 70s, 80s years of life. Because that group, the veins have lost their elasticity.
Okay.
So it is not functioning as it's supposed to. So you tend to see it in the older groups as well.
Okay.
You will see it in persons who wear a lot of high heels.
Mhm.
Yeah. Persons who wear a lot of tight clothing, girdles as well. That's on a constant basis and everyday thing for a long period of time. Why? Because imagine the girdle is you want your tummy to look flat. So
It's an extra pressure.
it's the
around
extra
that
pressure
area.
here. Okay. So in your abdomen, your stomach area, you have the main blood vessel, the aorta and the vena cava, that supplies blood to the leg and takes the blood from the leg. So when you have that compression in that area here, you actually compressing and the blood flow slows down. It slows down in returning. So you're causing a higher pressure in the leg, and with that higher pressure, the valves now gets weak because it has a high pressure to
Constant
work
pressure. Yes,
Okay.
yes, yes.
Okay.
So ladies, take notes.
Yeah, I think that's very important
Yes.
information because it's very trendy.
I was just
Not
about to say that.
not
Yes.
necessarily the traditional girdle, but what we call the body shapers,
The body shaper.
and the waist trainers. Yes, those things that apply high pressure around the midsection. So that's trending now. So that's an interesting
Yes.
piece of information, to know that it can
Affect
put us
you.
at risk. Yes, yes.
But this is with constant use. So if you use it occasionally, only just when
Occasionally,
you go
yes.
out to a function, it wouldn't pose as much of a risk
No,
for those who
but
wear it on a daily
it has to
basis.
be a constant,
Constant use.
constant use.
Okay.
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 And
The
so
high
now
heels.
the signs and the
For me.
symptoms.
Mhm.
The number one sign that the doctor will see, doctor sees the signs, the patient feels the symptoms.
Okay.
So the first symptom they will see is the swelling of the legs.
Okay.
The swelling. They will say, when I wake up in the morning, my foot is flat and nice. And during the course of the day, they feel the feet is getting heavy, their shoes are getting tight, and they have to take off the shoes. So swelling is the number one sign and symptom that
Okay.
will be experienced.
So
by the
swelling of the
patient.
feet.
Yes, swelling of the feet.
Okay.
So
Okay.
that's the entire leg or just the ankle and foot area?
You will mostly stay to the foot, ankle, and the foot distal portion of that leg.
So the lower.
So it all depends again on how insufficient, the grade of insufficiency that the patient has. It all
Okay.
depends.
Okay.
But
Okay.
it's basically to the lower part of the leg.
Okay.
Okay.
Of
So the
leg.
lower part of the leg. Okay.
The
So
lower part of the leg.
swelling in any
Swelling.
pain.
You will have pain.
Okay.
You may have some cramping as well, even difficulty walking. You will
Okay.
have pain.
Okay.
You will have a lot of itching.
Ah.
Yes. Remember, the veins carry waste materials, carbon dioxide. Now, when these waste materials they stay stagnant in that area, in the lower part of the leg,
Mm-hmm.
they have effects on you.
Okay.
And itching is one of these effects.
Interesting.
With the itching, you will have the hyperpigmentation or the dark discoloration of the leg, especially to the lower part of the leg.
Mm-hmm.
So we have the itching, we have the dry skin
Mm-hmm.
as well, and the dark discoloration.
Mm-hmm.
Eventually, the person will have a dermatitis or inflamed skin around that area as well.
Okay.
Okay?
Okay.
And that can lead to further complications.
Okay. So
There's a question I want to ask. So I've seen on certain patients there are red spots towards the back of the leg, which also accompanies the swelling and pain. Can the red areas or spots be associated
It's
with?
associated with it, with dermatitis or cellulitis. It can be.
okay.
So is that an indication that there is leakage of blood outside of the veins or so? The color I'm speaking of.
No, it can be. If the person has very dilated veins, the veins can rupture and you can have a leakage of blood underneath that skin, just like a little
area.
hematoma
Okay.
underneath
Okay.
that skin there.
Okay.
Okay, so it can be.
So
Yes,
the
it
redness
can be.
could be a pooling of blood. Okay.
Right.
Okay. So swelling of the lower extremities. We said, Dr. Abel, itchy, the skin being itchy,
Itchy.
starting to
Right, yes.
darken, or the hyperpigmentation. Pain is possible. Is it typically severe pain, or is it just, dull
It's-
pain?
Some persons will experience a dull pain.
Okay.
And when they sit and they elevate that leg, they feel a relief.
Okay.
Because the blood is flowing back.
Right.
So when you elevate the leg, the
Mhm.
blood tends to flow back. So you feel a relief
Okay.
from that pain. So it's like a dull, some would say an annoying pain.
Okay.
But not necessarily an intense pain as you will get in the other circulation
Issues.
that will
Okay.
come to.
Okay.
Yes.
So, dull pain, itching, darkening of the skin, swelling. These are some things that people
You
can
look
look
out
out for. Now, what if you have these signs or symptoms? If you have this for a prolonged period, what are the risks of having venous insufficiency or having the symptoms for a long time unattended to?
So here we come to the part with the complications.
Okay.
The complications of venous insufficiency. And one of the most feared complications is having a venous ulcer. And these venous ulcers are very difficult to close once they open out. Persons have had venous ulcers for 20, 30 years, non-healing. So this is one of the most feared complications of venous insufficiency. And the ulcers come about when you have the dry skin. You will tend to get cracks in that skin, and there's the sweat, the bacteria from your skin enters into the crack, and then it starts to develop into an ulcer. Yes.
Okay. So an actual outward ulcer or ulcer on the skin of
Yes.
the foot
Of the leg.
of the leg. Okay. Wow.
Wow.
Okay.
So, go ahead.
Another complication, you may find the person may say their leg looks deformed, and that is one of the another complications, that it's called an upside down champagne bottle appearance. So if you know what a champagne bottle is like, you have the neck, and then you have the bigger base. And when you turn that champagne bottle upside down, you're going to have the bigger base, the base
At the top.
up, and then the neck of the bottle. So we'll actually see persons will say, but doctor, all of a sudden I find my foot get big on top, and the lower part skinny. There's a term for it, lipodermatosclerosis, but it is also called the upside down champagne bottle appearance. So the upper part of the leg will be bigger, and by the ankle area would be small.
Okay. Wow.
Very interesting.
I'm trying to visualize
Yes,
the appearance. the upside down
yes.
champagne bottle. Okay.
Yeah.
All right. So venous ulcer, the deformation of the limb. Okay. Any other complications that may arise?
The varicose vein.
Okay.
The varicose vein, you actually see the dilation of the veins.
Okay.
Now we have different sizes. We have the very small veins, and we have the very large veins under the skin. So you may see some persons will have just like spider veins, what we call the spider veins, little light blue lines, and you may see some persons that have the very big, like serpent-like veins under the running like snakes right under the skin. Now, these varicose veins only happen to the superficial veins.
Those
Okay,
close to the skin.
Yes.
we close to the skin, like right underneath the skin. The deeper veins, they don't get varicose or dilated because they are compressed within the muscles, so they don't get varicose. But however, any problem within the deep veins will be seen in the superficial veins, if you understand, because they are connected.
Okay.
They are connected.
Okay.
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 So these varicose veins, they can get complicated. They can bleed out because of how superficial it is. Some persons I had a patient when I was studying. She had a cat, and the cat jumped on her, and one of the claws of that cat ended up nipping the vein, and she had a bleed. So that is what we'll call an external hemorrhage, an external bleed out. In some persons, the blood can bleed out, but it stays like a hematoma underneath. Okay. You will tend to see it in persons who have very high blood pressure. The pressure is so high in that circulation that it actually bursts out the vein. But in these two cases, it's basically the same treatment. To elevate the legs, you bandage the legs, and you keep it there for 3 days. You get some antibiotics and a tetanus vaccine shot.
Okay. Okay.
So you mentioned something about the high the high blood pressure or the suffering with high blood pressure. How is it worse for individuals who already have or suffer with high blood pressure to have this type of condition where it poses extra pressure to their extremities?
How is it worse?
Yes.
They have to, well, these persons, they have to try to maintain the pressure within normal range.
So even
because the
more.
high pressure, imagine that the walls of the veins are already weak and the valves are not functioning properly. The high pressure within these vessels, they exert or they push on the walls and making the veins dilate even more or make them get bigger even more and causes more symptoms for these patients.
Okay.
So it is even of greater importance for someone suffering with high blood pressure,
high blood pressure.
to have their pressure regulated
Yeah.
and have their frequent checkups with the doctor and follow-ups.
Definitely.
Yeah. Okay. Nice.
So, doctor, let's talk about the way forward if someone has. Well, first of all, how would you diagnose venous insufficiency if someone presents with those symptoms in your office? Like, what makes the diagnosis for you? What specifically would you need to make that diagnosis, and then how would what would you treat?
Okay. So to make the diagnosis, we look at the job of the patient. We take all this into consideration.
Okay.
Their job. We look the physical examination, a proper physical examination of
Okay.
the patient. We look for the signs and the symptoms that we already mentioned. We look for the darkening of the skin. We look for the veins under the foot. We look at the dry skin that the patient presents. Okay, and an ultrasound, a Doppler ultrasound. So there is the clinical aspect of it, and then we do the radiological aspect of it, where a Doppler is done, and we do the scan of the legs, and it helps us to identify which vein is insufficient.
Okay. So
Okay.
you can specifically
So-
see which vein. Okay. All right. I see we have someone trying to call. Let's take this call. Caller, good morning.
Hey, blessings to all you ladies. What's up?
Good
We're
morning.
good, good
Rebecca.
morning.
Thank you.
And my auntie is the doctor, if you don't know. My auntie that there. Penny already know he was in the studio or he was just singing. Anyway, God blessings. Just joking. Don't bother with me, no? My beloved sister and auntie, what's up?
Good morning. Good morning. How are you this morning?
Blessings to you. Thanks for everything. Just a little question, Doc. I am following it on social media, but you have experts talking about seed oil. And there are a lot of people that are suffering with poor circulation, and they are relating it, or correlating it to all of this saturated stuff in the seed oil and all of that, corn oil. And they're saying, how do you make oil out of corn? Sunflower oil and many other oils. And they're saying the process of making it, how dangerous it is for people to be consuming, like canola oil. And these are great minds, and they're worried about that. Can you please do a little research on them, Doc, and maybe advise your patients? I know I am two of them, not one, no, I am two of your patients. Is that true, Doc? Anyway, not all. and advise your patients how to go about not ingesting certain things, because these are contributing factors to further injury, adding insult to injury, as the saying goes. And thanks for the education and the listening. And thanks for everything. God bless you to all this. Take care.
Thank you, caller.
Thank you, Mr. Blessings. I will most definitely look into it, and I'm sure you'll have me again, so we can give proper information to the patients.
Yes.
But before I continue, he brought up a very good point about our intake and the type of foods that we eat. How how relevant is our diet
Mhm.
or bad eating habits contributing to the health or the functioning of our veins? So like fatty deposits, does that play a role in helping or contributing to the blockage of veins or arteries?
Our diet plays a major role in the circulation,
Mhm.
not only in venous, also in the arterial aspect as well. The high fatty substances, the cholesterol, they all deposit on the walls of these blood vessels. And when that happens, it weakens even more the blood vessels. And as a result, they are not able to function adequately. So the high salt content diet, the canned foods, the processed foods that we eat has a very important factor into this disease. They play a very important factor into this disease. And also the green leafy vegetables, the kale, the spinach, the watercress.
Lettuce and
They are very rich in vitamin K.
right.
And someone with venous insufficiency should not ingest as much vitamin K. Why? Because it thickens the blood. And if the blood is already moving along slowly in the legs, more vitamin K will even make it slower,
Okay.
reduce the speed.
Could it result in blood clots?
It can result in blood clot.
Okay. Okay.
It can result in blood clot.
Okay. Let's take a call. Caller, good morning.
A very good morning. Is that truly Christian?
Yes, it is.
That's Richard Lufa.
Good morning to you.
Good morning, doctor.
Good morning. Good morning. How are you this morning?
Doctor, just one question. What causes cramps in the leg? I mean, I heard you talking about veins and so. Does it have to do with the, if you suffer from arthritis or the cold weather? I would like to know.
What causes cramps in the legs?
Cramps? Okay. Cramps. Okay. Thank you, caller.
A cramp in the leg may be of different etiology. There are different causes that can cause cramps. You have an arterial cramp, which is caused by the lack of blood supply to the legs, and the muscles are asking for blood. And the way they ask for blood is by causing cramps, like not enough circulation is going there. Okay, we also have the venous cramps as well because of the amount of carbon dioxide and waste materials that the muscles want to try to get rid of it. That can cause cramping.
Okay.
And then you have the nerve pain as well.
Okay.
That can cause cramps.
A
So there are
different type
different
of cramp,
there are
right?
different types of cramps.
Okay.
There are
Okay.
different types of cramps.
All right. Let's take another call. Caller, good morning.
Yes. Hello, good morning.
Good morning.
I would like to congratulate the doctor that is there. I never knew Dominica had a doctor like this sort. But let me tell you, our Dominican people, they are very ignorant towards this illness. Because if they see, first of all, sometimes they give you a sore. And if they see you with a sore, they think that somebody spoiled you. So this doctor that is there, I am glad to educate him, the Dominican people, because once they see you first, oh, somebody spoil you. So God, big up to you and Jolly for having this program.
Thank you.
Thank you very
Thank you,
much.
caller. Yes, and that's what health education is about. Because, doctor, you did mention the venous ulcer that can arise because of this condition and how it may, be long lasting in terms of its duration. Let's take another call. Caller, good morning.
Yes, good morning, good morning. My name is Marlene. They push Marlene number 1007, boom. I just want to say a pleasant good morning to all the beautiful ladies on Q95. Q95 is the People's Station, one of the best radio stations
in Dominica and the entire world. I want to say welcome to the doctor that is there. And all of you all are doing a fantastic job. But I have a problem. And one of the biggest problems in Dominica, my pressure is high sky. It's over 200. Because the reason why you all had a very nice, loving, hard-working lady, honest, Miss Jeremiah. I call her Dr. Jeremiah. She used to do my pressure, my blood test. And I'm so angry that they sent her behind God's back. She's not in Great George Street again in Roseau. I'm missing her. I'm crying. My pressure is going high sky. I can't cry. So all I want to see, my darlings, bring her back. I'm in Roseau. And they sing, I call her my doctor. And let me just say, had to Stella, Gemma, Mary, and Stella, Gemma, Mary, and all the others. But bring back Jeremiah. I call her my doctor. And darling, keep up the good work. May God bless all you. I wish all you a happy weekend. Up I gone. Boom.
Thank you, Marlene. So, Jolly's, but I'm sure other people can assist Marlene with her blood pressure monitoring at Jolly's pharmacy, but she's missing Miss Jeremiah. Okay, that is point well taken. But doctor, we were going into the treatment for venous insufficiency. I wanted to know, you did mention how you would diagnose when the patient comes to your office. You would take the history, their careers would maybe give you some insight. They could do the Doppler imaging so you could see the veins, and which is insufficient. But how would you then treat?
In terms of treatment, we have different forms of treatment. There is the conservative treatment, and then there's surgical treatment.
Okay.
Yes. So when we say conservative treatment, we change the person. The person has to change their lifestyle. Avoid constant standing. Okay.
But that's a tall order. So what if it's the person's profession and they're still employed in that profession? I know, for instance, you mentioned security guards, policemen and so on. So how do they avoid the constant standing?
So that is where the compression stocking comes in.
Okay.
And that compression stocking is of daily use. Daily use for as long as. So you wake up in the morning, you do your little, make your breakfast, but before you leave your house, you put on your compression stocking.
Okay.
You only remove it when you're going to take a bath and when you're going to sleep. But it is of daily use.
Okay.
Daily use.
So if you're continuously standing, you have venous insufficiency, you need to wear those compression stockings. Okay.
You need to wear the compression stockings. Weight control is also a factor in conservative treatment. Okay. Now, when we say weight control, we don't want you to lose a great amount in a short period of time, because that is going to even worsen the venous insufficiency. Why? Because the fatty tissue acts as a support to the veins as well. And if that fatty tissue is lost drastically, that can make the veins even weaker. So it's something that you have to do cautiously.
Gradually.
Gradually.
Okay, so weight loss, use of gradual weight loss, use of the compression stockings.
The diet.
Okay.
The diet. The low salt diet.
Okay.
It's important to maintain you have to maintain the blood pressure optimum.
Low salt diet.
Low salt
okay.
diet. The fatty content. Low cholesterol.
Okay.
As well.
Okay. Let's just take a call. We have a caller on the line. Let's just take this caller. Caller, good morning.
Good morning, doctor. I wanted to find out whether you have a private practice here.
Yes,
yes, I do. Yes, I do.
And where is this?
Okay, we'll give the details after the program.
Yes.
Okay.
Okay.
Yes. Yes.
Towards the
Thank you
end.
for listening.
Okay, we have been diagnosed with this also and got to know some more information. God bless.
Okay. Okay, no
nice.
problem.
Okay. Yes. So we'll give Dr. Abel Simmons information, contact, and location at the end of the program. So you need to stay tuned because we do that at the end. But yes, doctor, you were speaking to the treatment for venous insufficiency.
And also we have skincare.
Okay.
Good skincare routine to avoid that dry skin. So you can use shea butter, cocoa butter, vitamin E oil, and rub it daily, 3 times a day, in the morning, in the afternoon, and in the evening, to prevent that dry, scaly skin. It helps with the itching as well.
Okay. So skincare. Okay.
Yes. And then we also have the different types of medications. Okay, for vein health. We use a lot of Daflon here in Dominica, and we have Venaton is another medication that I have asked Jollis to incorporate, and they have it on the shelf. Thank you,
Venaton
Jollis.
is on the shelf. Okay.
Yes.
So Venaton.
Yeah.
You said
Venaton.
Daflon?
Daflon.
It's a
Okay.
prescribed medication.
Okay, because I was saying I've
Pentoxiflozine.
never seen it, so it's prescribed.
Yes,
Prescription.
prescribed.
Okay.
Okay. So what these medications do, they are supplements, but they also have certain components that help keeps the walls of the vein toned,
Okay.
so that they do not expand or do not stretch out
Too
to
much.
to get
Okay.
varicose veins. Now, bear in mind that the veins that are already varicose or stretched out, they don't go back to their normal size.
So that's a permanent disruption in their structure.
Yes.
But you can, I guess, prevent others
Exactly.
from reaching that state by using those supplements.
Yeah.
Okay.
I just want to inform our listening audience that we are Jollies. We do have those medications and supplements along with the Daflon. I know some doctors also prescribe pentoxifylline. Right. The Venaton has been not a recent addition, but we've had it for quite some time.
Okay.
OTC option we also have in the dispensary section. In terms of the compression stockings, there are different types of compression stockings. There are those just knee high, above, and based on the severity of your condition, there are the different types that
Strengths.
present like different types of pressure
Yeah.
applied to the leg area. There are supplements, as Doc mentioned. I have one with me. It's called the leg vein and the circulation. So it's actually a combination of different types of herbs together that helps with leg vein health and circulation. And we also advise vitamin B's as well for nerve function.
Okay.
Because many patients, as you know, Doc, would talk about sensitivity or tingling and sensation. In terms of the creams, we do have vitamin E, either the capsules if you prefer to break up the capsules, or the cream itself, the oil itself. And we have our Babyliss line, and one of the products is the moisturizing cream and also has antiseptic properties.
Very nice.
So for those who have ulcerated skin or some type of skin condition that renders antiseptic guarding, this can also be an option.
Very nice. So we have a variety of options at the pharmacy. I want to ask a little more about the compression stockings and what's available. But let's take a caller. We have several calls coming in. Let's take a call. Caller, good morning.
Hello, good morning, Julie. Good morning, Justin.
Good morning.
From my district. I want to ask a question to the doctor. For example, if you have somebody with the disease you're talking about, right? And that person stands a lot, because you mentioned, how you can get people who stand a lot. If you have a patient and a patient come to you, and that patient fall in that category for probably a hairdresser, standing a lot, working somewhere, is it in order? I'm just asking. Probably you would
tell the employer of that employee as though they could give that person a little permission if just to sit down 10 minutes probably when they are not cashed in. You know, because I know some cashiers you stand all day.
Very true.
Some places you have a chair so. But I'm just wondering if it would be within your purview to tell that employer, well, you know, give her a little break, give him a little break, 10, 15 minutes, probably when he or she not cashing. Thank you.
Thank you, caller.
Yes.
I think that's
This is something that should be taken into consideration.
Mhm.
There are also different types of exercises that can be done whilst you're standing.
Mhm.
Okay, you can flex your foot, go up on the hill and go down
Mhm.
to try to get that circulation moving as well. But the sitting for 15 minutes, 10 minutes is very important and it should be taken into consideration
Okay.
as well.
I don't think that someone should wait until they are diagnosed with such a condition. I guess it's like a preventative measure.
Mhm.
So all who are standing for very long periods of time should have a little break, and like you said,
Exercise is
to
important.
Mhm,
incorporate the exercises as well.
Mhm. And as we continue to educate some of these occupational, I would say occupational hazards, employers will understand them better and put things in place to facilitate the proper health of the good health of their employees. So we do notice that in some institutions there are seats for people who are doing frontline work like cashing, and so on, or bank tellers as well. So we do see some of those changes. So I guess gradually more will come along.
I hope so.
Yes. Let's take another call. Caller, good morning.
Yes, good morning to you, Trudy.
Hi, good morning.
And good evening to Jacinta
Hi,
and
morning.
then the doctor in the house.
Good
Yeah,
morning.
I've been listening from the beginning, and I wanted to interject something, and I just heard the doctor mention it a little while ago, which is the exercising of these muscles. So you have these two groups of muscles in that area, the gastrocnemius and the iliacus muscles, right? So a lot of people, I find that even standing a lot, and for even just ordinary people that maybe doesn't really do regular exercises, I think that's one of the biggest problems, because exercise plays a great role in problems like this, because people that standing a lot, sitting a lot, I mean, too much of one thing is good for nothing. But at the same time, why is the heart is there pumping the blood down to that area? What brings it back up is these two muscles. And a lot of people are actually not working out these muscles. So I wanted to interject exercise there, but I just heard the doctor mention it, which I think is very, very important. And they are the larger group of muscles in the body that actually need that type of exercise for cardiovascular health and for good circulation. I mean, all these other supplements that Jacinta spoke about, I mean, these are essential, but without the exercise, to take them around and for absorption, it's no good. So everything has to, in other words, everything is interconnected. So the exercise, the rest, the good postures, everything has to come together, because too many people suffering from these problems. And most of the times, I mean, a lot of people is like, you have nutrient deficiency playing a part there, and then you have exercise playing a part there, or lack of exercise. So I really wanted to interject that. Have a good day. Great program as usual.
Thank you so much.
And just simply walking in a day. 30 minutes, 15 minutes to go, 15 minutes to come back is very important.
It's helpful.
as well. It's helpful.
Okay, so walking, the exercise. You mentioned, of course, the supplements that we, or the medications that we discussed, the use of the compression stockings, the elevation of the legs, weight
Diet
loss,
control, yes.
yes, and diet. Monitoring the diet, low salt, low fat. Okay,
Skincare.
and skincare. Yes.
There is something else that I want to ask Doc. What about the manual massaging of the legs? Will this help with the circulation?
Yes, it does. It does. So we have physiotherapists who actually do this type of massages to help, with the flow of the blood to the.
So is there a specific technique, or can somebody just massage as normal? Or it doesn't have to be done professionally?
It should be done professionally.
Okay, I don't know if you're just rubbing.
It should be done professionally.
Okay, thanks.
For the people listening on the radio and not viewing us live, you missed the demonstration Jacinta was giving of massage. That's why we're laughing here. Jacinta's massage technique. Let's take another call. I see we have several people calling in. Caller, good morning.
Yes, Doc. Something you forgot to mention. When people have this kind of a disease, you cannot go in hot water to bathe.
Okay, thank you. Yes. So the heat
Okay.
affects this venous insufficiency.
Ah.
Okay. So the patients will tend to complain more of their symptoms during the summertime.
Ah.
Yes.
Okay.
So heat, you should try to avoid exposure to heat.
Ah.
Even the bakers as well,
Mm-hmm.
the chefs being exposed to a lot of it, it actually worsened
The condition, the symptoms, very interesting. And I guess soaking in the hot water baths
would
and
just
so on
say
would
the
not
same.
be for people with
venous
this condition.
Okay,
Interesting.
Very interesting.
Okay. Let's take. Okay, we lost that caller. But yes, Doc, we've mentioned some of the treatments. Jacinta, I wanted to ask about the
stockings.
compression stockings.
Yes.
You did mention that different
Mhm.
strengths
Right.
are available at Jolly's and different lengths, like
Right.
below the knee or above the knee.
Right.
What about sizes?
Yes.
What type of sizes do you have?
We have a wide range, and
Okay.
in fact, when someone comes in for compression stockings, we have our measuring tape.
Ah, okay.
So any one of the floor staff is able to measure the width
Mhm.
of your legs,
Of the calf, okay.
of the calf area,
Mhm.
and then on the packaging
Mhm.
has both the width
Mhm.
and also the strength. So how
Okay.
much pressure you'll get from that particular compression stocking.
Ah,
so
okay.
there are measurements to be
So
taken.
the strength, not everybody needs the same strength.
Okay.
It all depends on the grade of venous insufficiency that the patient has
Mhm.
and which veins are affected.
Right.
Okay.
Okay, so a smaller strength or lighter strength may not work for somebody whose deep veins are severely
Impacted.
Damaged,
Okay.
affected. Mhm.
Okay.
Okay.
Somebody who has a venous ulcer will need a high grade strength.
Okay. Okay.
So it all depends on what the patient presents.
Presents with. Okay. All right. We have a caller. Let's take this call. Caller, good morning.
Hey, good morning again. I just wanted to ask the doctor a question. In terms of supplementation, what are your views on magnesium, especially magnesium glycinate in situations like that?
Yes, magnesium is very helpful as well. It's a supplement
Okay.
that we should be taking daily as well.
Yes.
Vitamin
Yes, that's
C,
Mhm.
folic acid. It helps significantly. It
Okay.
helps with the pain. It helps with the toning of the walls of the blood vessels. But magnesium is very important.
Okay. So magnesium, folic acid, vitamin C.
Vitamin C,
Right.
vitamin B12
Vitamin B, yes,
as
yes.
well. Or
Okay.
B complex.
Okay. All right. Let's take
Have
this
another
call.
Okay.
Caller, good morning.
Good morning, ladies.
Good morning.
Well, I was talking to a lady about massaging, right? And she told me, I was telling her about a blood clot. But she made another white thing. I'll let you know more about that, please.
Okay. Thank you, caller. So he's asking about massaging as it relates to blood clots. I guess the movement of possible blood clots if you massage the area.
Okay. So if you are in an acute phase
Mm-hmm.
of a blood clot, a DVT, you don't do any massages.
Okay.
Okay, because you are predisposing yourself or the patient to presenting an emboli. You can
Mhm.
actually break up
The
the
clot.
clot and cause it to move to the legs.
Mm-hmm.
Okay, now persons who have DVT, 10 years down the line, 5 years down the line, they present with the venous insufficiency.
Mm.
Yeah. So the DVT or the blood clot, which we usually call it, it's the clot inside of the deep veins.
Okay.
So this clot, depending on the size, how big it is, how much occlusion it causes, it affects the flow of the blood in the deep veins.
Mm-hmm.
And because that flow is affected, then blood has to run from the deep veins into the smaller veins.
Okay.
So the smaller veins have to assimilate the job of
Okay.
the deep veins.
Deep veins. Okay.
Bearing in mind that the deep veins carry up to 98% of blood in the leg.
Wow.
So that these smaller veins, they are going to be overworked.
Okay.
Yes, of
Okay.
course.
They're going to be overworked. And then we have that venous insufficiency. The patients will have the darkening of the leg, the swelling, and the pain. Okay. So we have to be very careful with the massage.
With the massages.
In the acute phase, definitely a no-no.
Okay. Okay. Let's take a call. Caller, good morning.
Hello, good morning.
Yes,
Hi,
good morning.
Very interesting program.
Thank you.
I've been listening from morning and I'm very impressed with the quality and the level of information given. Dr. Abel, maybe you don't remember me, but I introduced myself to you about a month ago on River Street. I was passing. I'm going to comment on the exercise. A simple exercise the cashiers and the people who are standing can do is the pumping activity, like leg pumping. Move your ankles up and down, like they used to do when people were sewing with the old sewing machines. Remember, just moving the leg up and down. That's very effective for the leg muscle. And as you mentioned, we have to be very careful in what massages you want to do. Be careful with the massage back.
Yes.
Okay.
Thank you,
If
caller.
I remember well, she's a physiotherapist.
Okay.
Yes.
Okay, so the pumping exercise with the foot, like up and down. Okay.
I just wanted to show you the upside down champagne bottle.
Ah, okay. Appearance of the leg. Okay. Okay.
Okay. Yeah.
It really looks like that.
We have another caller. Let's just take this call. Caller, good morning.
Yes, I have to call a lot on that topic because that is in my range. But let me tell you, the more you bathe in fresh water like rivers and the tide water, it helps to relax the veins.
Thank you for your comment. Yes.
Okay.
Yeah.
Okay.
Okay.
Thank you, caller. Yes, Jacinta, you were going to ask something.
Yes. So, Doc, in terms of the massages, for the legs, especially you mentioned those who have been diagnosed, but what about individuals who have not been diagnosed but present with those symptoms that you spoke about? So, if let's say you have an appointment and the person who does the massage realizes that their client has darkening in their extremities or swelling, or the patient complains of pain, I think they should advise their client to seek medical attention first to see if it's safe enough to do it. So it's not just those who have been diagnosed. So if you present with some of the symptoms that we've spoken about, then that should raise a red flag.
Yes.
Yes, precisely. And not just masseuses or masseurs or masseuses, but also people doing pedicures as well, because they will view the appearance of the feet and the lower limbs. And sometimes in some pedicure treatments, a massage is also included of the feet and the lower limb. And so I think these professionals should, be aware and be educated of this particular condition, because they would be the first line sometimes of seeing that and advising the patient to seek medical attention. Yes, so that's very important. I hope we have some of those providers listening, or if you are listening and you can share it with people in that particular profession, people doing massages, people who are doing pedicures and so on, so a spa therapists, that's very important for them. Okay. I think we have another call. Let's take this call. Caller, good morning.
Morning, Miss.
Good morning.
And morning to the guest, the doctor.
Yes, good morning.
Good morning.
And morning to the people on the program.
Good morning.
Very, very educated program this morning.
Thank you.
Because one of the biggest diseases on the land is clots, because most people standing sometimes for the day, like constructors, builders, doctors, nurses, just name it, farmers. And it's a very rare sickness. People don't pay much attention to it. I just want to ask the doctor, beside the pharmacist medicine for the blood clots. If you have a patient that decide they want to use the natural medicine, for instance, the turmeric powder, clove powder for digestion before eating in the morning, Lucy would recommend them to use the natural medicine. Ask for the cayenne oil. The cayenne oil is something you use to massage the leg, but you don't rub the knee. You rub the leg, and you don't rub the leg hard. You pass your finger light on the leg with the clutches, like the veins and the movement. And there is quite a lot of natural way you can use for the clots. Like when you suffer with blood clots, if you have when you go and lie down, you put a bag over your bed, like a crocus bag at a certain height, and you tie the both ends of the crocus bag, and you put your foot in it with like a pillow. That's one of the areas they use to deal with blood clots. And blood clots is a very sensitive thing. Not anybody can deal with it. You have to have specialists. But do she recommend natural medicine? And my name is Ronnie. I also do natural products like the cayenne oil, comfrey oil, comfrey cream. You could get some of the products by Jolly's. I don't know if it's still on the shelf. I want you to continue to educate your people. And we have a lot of cartilage problems, like teachers, when they stand for long, they suffer with bones, they lose the cartilage. And I want you to continue. People like you must open the way to get some specialists to come and do some surgery down here. Have a good day.
Thank you, caller.
Thank you.
Yes, doctor, your view on some natural remedies?
I love natural medicine. I love
Mhm.
natural medicine. We cannot go wrong. But what we have to bear in mind is what is the concentration of natural medicine that the patient has to take.
Always
Mhm.
our
Okay?
concern.
Mhm.
That's the concern.
Mhm.
Garlic is important, cayenne pepper, turmeric,
Mhm.
chive, all this helps with venous insufficiency.
Okay.
So yes, it can be taken.
Okay.
But we should know the proportion at which we are taking.
Mm-hmm. Okay. So we've done quite a bit of information on venous insufficiency. We had wanted to touch on peripheral artery disease. Doctor, we have a few more minutes. I want you to maybe just define that one, and I guess we can maybe follow up in a later program because we did go quite a bit in depth on venous insufficiency. But peripheral artery disease is something I know also that quite a few people suffer from. So I just wanted a little insight from you on that condition.
Before I go into that, we did not mention the surgical treatment of the
Oh,
venous
yes,
insufficiency.
yes.
Okay. Just to mention them, we have the stripping of the veins, where you
Uh-huh.
actually take out the superficial veins that are insufficient.
Mhm.
There is the sclerotherapy, where we inject the veins with a special substance that causes them to diminish in sizes.
Mhm.
And then there is the laser therapy as well, where you use a laser to actually seal off or burn off the veins.
Mhm.
Those
Okay.
that are no longer functioning properly, or
They are the veins that are insufficient. The
Okay.
Yeah,
varicose
you
veins.
seal them.
The
Okay.
varicose veins,
So
you seal them.
sclerotherapy,
Mhm.
or
Removal of the
removal,
vein and the laser therapy.
laser. Okay. So
Laser
3
therapy.
options. How would you determine though?
which one?
No, like if to go surgical or with the conventional
It all
treatment.
depends on the patient
Okay.
and the aesthetic
Ah.
views of the patient, what they would like. Some people may not want any scars on their legs, so you want to do an endo laser therapy for them.
Okay.
Okay. So it all
Okay.
depends. It all
Okay.
depends.
All right. Okay. Thank you for that.
Okay.
Yes, doctor. So yes, venous insufficiency was our primary target, but just a little insight on peripheral artery disease before we have to close.
So peripheral artery disease. The veins, okay, so the veins take blood from the tip of the body,
Mm-hmm.
the tip of your toes, and brings it to the heart.
Mm-hmm.
The arteries, on the other hand, take the blood from your heart to all parts of the body.
Mhm.
So it supplies the body with oxygen and nutrients that is required to live, to survive on.
Mhm.
If you have a blockage in that artery, in that blood vessel, then there is no supply to the organ or to the part of the body that requires the oxygen and the nutrients, and it will eventually die away. So think of a pipe which is flowing of water, right? And over the course of years, this pipe sediments is going to build up on the walls of that pipe. Okay, and that sediment can grow and grow and grow and grow until it can cause a complete blockage, and then there is not enough circulation beyond that blockage to cause or to give life to that part of the body. So that is what peripheral arterial disease is: the inability of the artery to supply blood to that part of the extremity or whatever part of the organ that is necessary.
Is it particularly common in our population, and maybe give us a risk factor or two for that condition?
It is common, and you will see it especially in the persons who are in their 7th or 8th decade of life. Why? Because this process takes decades to build up. So it will start in our age group. And it will build up.
To older
until
people.
we see it in the 8th decade of like 80 years, 70 years. However, patients who are diabetic, this process speeds up 5 times faster, 4 times faster.
Wow.
So where you will see it in an 80-year-old or 70-year-old or diabetic patients, you may see it in a 50-year-old or 40-year-old.
Okay. So this is a condition, I believe, Doctor, if you're saying it's common, that we maybe need to spend a little more time on in another sitting, another show. But we're already approaching the end of our time. So I wanted to, of course, maybe take the opportunity for a last call and then for some concluding remarks and information from you, Doctor. Yes, caller. You are our last caller. Good morning to you.
Yes, why not? Let me ask you, Doc. Everybody in Dominica that have this illness, I feel with salt, can they be healed?
Okay. Good question. Can the ulcers be healed?
The ulcers can be healed. It will take a very long period of time. So imagine you have somebody with an ulcer for 20 years. We will not expect complete healing in 10 days or 20 days. It's a very tedious process. It requires a lot of dedication and teamwork as well from the family members at home, from the district doctors and nurses as well, to maintain proper standard and proper protocol to help this patient heal. Okay. In terms of healing, the patient will require numerous factors in terms of wound care, and the most important would be providing more oxygen to the wound to help it heal. And this is what will slow down the process if the oxygen is not reaching the wound as it's supposed to, because oxygen is necessary for healing. Okay, so that is very, very important, and the type of dressings that is used can deter the healing of the wounds. Okay, now you have patients when they notice that the wound is starting to heal, the wound is starting to close up, they go back to the usual
routine
working, and then the wound opens up. Okay, so we have to be very, very careful with these types of wounds.
Just very quickly as we close, we mentioned the other supplements and vitamins, but what about iron? And I know we mentioned vitamin C. I mean, it helps with the absorption of iron, but imagine someone who is anemic. Their blood level is very low, and you need the blood to carry, the oxygen and nutrients to the organs. So I think this is very important as well, to have a normal blood count or high enough. Yes. And then one last question, Doc. Many individuals soak their feet, so like in Epsom salt and whatnot. Is this healthy for people suffering from?
I don't recommend soaking of the feet. It may be good for one circulation, but not good for the other circulation, especially if you have arterial disease, peripheral arterial disease.
Yes.
Okay, so that is something that we have to be careful of, because the moisture can actually worsen the symptoms that the patient has.
Okay. Thank you.
Yeah, so you see, not one size fits all, because a
Yeah,
lot
I
of people
know.
would just say soak your feet.
In Epsom salt
Yes,
especially.
Epsom salt. Yes,
Right.
yes. So that's why it's so important to know your particular condition, or you seek medical advice before you take any remedy that is recommended. But it is almost it is 11:30, and that is where Health Vibes ends. But doctor, and I see we have a lot of people who were trying to call. Unfortunately, we were not able to take all the calls, but I do encourage you to look out for the platform on Jolly's Pharmacies Facebook page, where more information will be shared as it relates to some of the treatment options that we discussed, and some things that are available at Jolly's for the treatment of venous insufficiency. And also just stay tuned to Health Vibes, because we will continue this and similar discussions in future shows. So apologies for not getting to all the calls, but you need to stay tuned. Doc, we want you to share your information. Our listeners, of course, may be wanting to know, where can they reach Dr. Abel Seaman? Where can they visit her? And so let them know where they can do so.
Okay, so my contact number 285-9586. Again, 285-9586. And my office is located on River Street. It's close to David Bruni's office, the lawyer David Bruni's. It's close to his office.
Okay.
So 285. It's close to the Marigot bus stop. It's in that corner area there. So
Okay.
that's where it is.
Okay. For those of us that don't know Roseau, yes, some landmarks. So River Street, close to the Marigot bus stop, and the phone number 285-9586 if you want to reach Dr. Abel Seaman, if you want to set up an appointment and visit her office. So she does have private practice. Yes.
Nice.
Thank you so much, Doctor. As I said at the start of the show, it's your second visit on Health Vibes, and I hope not your last. And we appreciate you taking the time to educate us and our listeners about vascular conditions. In this instance, today's show, venous insufficiency, which was trending in the media recently enough because of a high-profile diagnosis. So thank you so much for your time. And yes, hope to see you again.
Thank you for having me, truly. Thank you. Thank you very much, Jollies. Thank you for having me as well.
Yes. Justin first, so we're signing out until another episode of Health Vibes. We typically meet you every Wednesday right here on Q95. So look out for us next week, God willing. And do have a good week and take care. Goodbye.
Take care. Bye.